Hi, I am here with Jen Herndon, and she is a graduate of the Breathing Deeply Advanced Yoga Therapy Program in the C-IAYT. And we are here to talk with her about a client she worked with. And I'm so glad you're here, Jen. Thank you
Yeah,
for doing this.
I wouldn't be here without you. Thank you.
And I wouldn't be
Um,
here without you. So tell us why she came to you and what her condition was and what she was looking for help with.
Yeah, she came to me as 34-year-old woman with autonomic diagnoses of IBS, fibromyalgia, Hashimoto's disease, POTS she was diagnosed with. And so it's been 2 years she's had that. Hopefully it's getting better. But fibromyalgia, you have one, you have a lot. And that's the truth here. So she came for that because she just needed to feel better. She's young and she wants to be able to do life.
How old is she?
34?
She's 34.
Yeah.
Okay. So she came to you and she was having a lot of symptoms from these things.
Yes. Heart rate, especially, was very high, generally all the time. Usually, when she'd wake up, it could be like 110, just laying there in bed. And she lived on the second floor. Her heart rate would spike way up. And so she was always exhausted, taking medications to try to keep it down, but it was also affecting her blood pressure, that medicine. So things that other doctors were trying for her was not helping her to combat those symptoms, which was really impacting all the function of her life.
Yeah. Was she able to go to work or whatever she did every day?
She was working 3 to 4 days a week, but standing up most of the day, which
Yeah.
is really hard for somebody with POTS. They get dizzy, they can fall over. And apparently she'd been having a lot of those symptoms since she was 21 years old, and they really just put it all together. So
Right.
she was just drinking a lot of water, sodium, and wearing compression hose and hoping for the best. Yeah.
Okay. So what kinds of things did you do with her in terms of your yoga therapy recommendations?
I One of the first things that we started with was some breathing, diaphragmatic breathing, just 3-part breath coming down into the abdomen with the diaphragm. And there had been a study in October of 24, I think, in European, I wrote it down, European Journal of Neurology, that was basically saying that diaphragmatic breathing was very helpful in reducing heart rate symptoms for people with POTS. And so I like to try to give people information like that so that they can take it and feel like, oh, somebody's looked at this, not me just saying it.
Yeah. Little
Anyway,
research always
right?
helps.
Oh, that'll help me.
Yeah.
But so she started with that, very basic, and learning to implement that during the day. We continued to meet. We've met for a very long time, 33 visits, I counted up, and it's been 15 months. And I'm still seeing her. We're all a work in progress, but her progress has been significant.
Can you tell us like the
Yeah.
kinds of things she does to help herself? Because I
Yeah.
think that's what people would want to know.
Yeah. Diaphragmatic breathing. She does that multiple times a day at
Mhm.
work. She does yoga nidra every day.
Just if you're listening, yoga nidra is like a
Yes.
specific technique, but it's basically a meditation you do lying down. That's guided, is the short version.
Right. Yes. Which significantly impacts the nervous system of the body, right? So our nervous system starts to regulate a little bit, our autonomic nervous system, which controls our heart rate, our breathing, our digestion, all of those things. So she has her own practice now of that has been very steadfast. And she's even sent me practices. It sounds so simple. I think it's so simple, but it's not when people have a challenge with trying to get things done. But she has grabbed onto it and it has helped her significantly. In December, and I say that she used to wear a device called the Visible, which tracked her heart rate and her heart rate variability. And so she could see how she was doing. The higher your heart rate variability, the more resilience, right?
Yes.
Resilient we are with our well-being. And hers was always very low. So it was showing her that it was getting higher. And she was sleeping better, more through the night, not getting up, having less pain in her joints from the EDS and the fibromyalgia, able to tolerate work better.
So was she doing movement practices
We would
and
do yes, like a she was Vata imbalanced, and we did a lot of that type of practice when we were together,
moving and breathing
moving and
kinds of
breathing,
things? Okay.
very gentle, because she's one with the diagnosis of EDS, she'll just lock out in the joints, and so her me trying to guide the practice was better off than a little bit more on her own initially.
And how about now? Is she able to do it on her own?
Yeah, she can
Oh,
do
great.
it more on her own now. Yeah, we've really been working on that habit of doing it and staying consistent with it so that she can have a sustainable, safe yoga practice.
I'm getting from you that she sees the correlation between doing these things and her symptoms. So that's not the
Absolutely.
hard. It's just organizing herself and keeping
Yeah,
herself on track. So would you say that's some of the work you do with her, like helping her figure out how to do what she needs to do
yeah,
so that she gets these results? Yeah.
correct. Yeah. I think that people, and I don't want to generalize this, but she's somebody very motivated. She's very motivated, wants to be better. Sometimes when folks, and I speak for myself, I know what it feels like to have chronic illness. So it can be difficult to feel motivated when you've been not feeling good for so long. And
Yeah.
I've
I,
worked
I
with
have also experienced that. So I know
yeah,
what you're
for
talking about. Yeah.
15 months, we've worked
Yeah.
together to get here.
If you were going to put it in, okay, so this is what I'm hearing. I get this person, she has POTS, she has this heart rate variability problem, but she also has other autoimmune conditions. So she's got joint pain, she's got issues sleeping,
Yeah.
any other big symptoms?
No, just fatigue will show up.
Fatigue. Yeah,
Fatigue.
a lot of fatigue. Okay.
Yeah.
And then how long did it take her to start to get benefits from the practices?
Probably within 12 weeks, I would say she was consistently feeling better.
12 weeks. So 3
Yeah.
months.
Yes.
Yeah, because I think that's something people would want to, because it seems like a long time. It really isn't, but it seems like a long time, 15 months, but it
Yeah.
really isn't that long to think about getting help with a very kind of large problem.
Yeah.
So she's clearly, it's not going well immune system wise in terms of
Correct.
all of her autoimmune conditions. So in 3 months, which I see that too in my practice, like over the
Mhm.
course of 2 to 3 months, you can usually find some meaningful change.
Mm.
And then what would that meaningful change was what at 3 months? What did
Well,
she,
sleeping a lot better. Sleeping a lot better. Just having a little bit more energy. She started going to a book club. She loves to read. She was having to do it on Zoom because she was too tired after working or whatever she'd had to deal with in the day. And so she would just Zoom and lay in the bed. Now she goes to her book club, and she was going after about 4 months, whatever the 16 weeks, she was going to the book club.
so she's out and about
Yeah.
again, living her life. And then where is she landed now?
Yeah, now she continues with her yoga nidra every day. She has been able to, this is pretty incredible, go take her car to our, we call it MARTA, which is our train station here, to the train station, take the train all the way down into our city, into Atlanta, and then go to an all-day conference
Oh,
and then go home. So she's physically, her energy level has increased.
yeah. This is a huge difference in her life.
Yeah.
And I don't know if everyone listening to this knows this, but POTS can be extremely challenging. And we're seeing coming through the practicum and in my personal yoga therapy practice, people are coming in their late 20s, early 30s, sometimes college age. Recently, I was working with
Right.
somebody, she had to drop out of college. So this is really, it can be a very difficult condition and it is very hard to treat. It's not like there's a medicine for POTS, take.
No.
I'm super interested in this case, just listening, because I'm like, wow, you have this woman who's on the decline and sounds like she turned it around. Her direction is completely different now. She's
Yes.
doing more things, not less.
Yeah, she actually went on a plane and went on a trip to see her family.
Yeah, amazing.
She was really would come home very extremely overstimulated from work. Her nervous system was just shattered. And now she can actually go to a movie when there's loud sounds and stuff. So just the socialization for her,
Yeah, yeah.
instead of isolation, there's more engagement. So functionally, her life is very different.
That must be rewarding for you as a yoga therapist to see
It's
this, right?
been really wonderful. She's
Yeah,
been very dedicated, and to see how she's done has been very much a blessing for me.
yeah.
So,
Amazing. Amazing. Let's see. I just want to tell people how they can find you. What town are you in?
Atlanta, Marietta.
You're in Marietta, right? And so you work locally there and also online, correct?
Yes.
And Jen is also recorded for a course for a new platform. So our wellness platform at Breathing Deeply, you can also find her there. And that course is really for, we're going to course for kind of hidden diseases, right? As you called it. And
Yeah.
these diseases, multiple diseases,
Right.
diseases that people don't understand that kind of take people from being in the world to
Yeah.
not in the world is an interest of yours, I know. But this is a good example of that, right? Somebody who is on a trajectory where, because I've seen people with POTS land not being able to go to work.
Sure.
So there's a lot of people who need help, right?
Yes.
In this zone. But I'm hoping if people are watching this, maybe they want to work with you, find
Yeah.
you.
I would love to help. I would love to help and offer my patience and my whatever insight I can give.
And I will just say at the end of this video that Jen is a lovely person, and I would send somebody in my family to her.
Oh,
And especially when someone's really sick, you're a little protective, right, of who you're going to
yes.
send people to. And I would definitely put you on the list of, people
Thank
I would
you.
feel
That's so
safe with.
sweet.
So I hope people that are listening to this, if they have someone in their life,
Yeah.
just know you're a really nice person, actually. I'll say
Thank
that.
you.
You're a
Keep
nice
going.
person and you're gentle and you really know how to hold space, especially for people who are suffering in this way.
Yeah. Thank you so much.
But I'm happy for you and your client. And
Yeah. It's been great.
I'm happy to see all the work you do in the future. Thanks for talking with me today.
Absolutely, Brandt. Thank you so much.
See you soon.